to take a minute and speak to you about functional testing. So yeah, a bit of a head scratcher, right? What does that even mean? Well, it means testing that looks at how the body's functioning. I'm thinking of something like a complete blood count. What's that? A CBC. What does that mean? That's when we look at white blood cells, red blood cells, hemoglobin, hematocrit, components that make up hematology, or a section in our body that looks at blood cells. How are the white blood cells functioning? Are they showing an infection? Is that infection a bacterial infection, a viral infection? So all these clues, when we take lab tests as a physician, we look then to have to see why and how we interpret that particular lab. As physicians, we choose certain labs for certain reasons, and it's based upon the following: taking a good history, which means listening to the patient because they'll tell you what's wrong with them. It means doing a physical examination. Then we come up with what we think as a differential diagnosis. Do the tests give us a diagnosis? Sometimes, but usually not from the functional tests. It's more like if your white blood cell count is low, we call that leukopenia. Is that a diagnosis? Well, yes, but then we have to figure out why. So if you say, well, I've been diagnosed with leaky gut, a functional diagnosis.